In October 1974, Dr. Chester-Wilk and 4 other chiropractors filed suit against the American Medical Association and nearly a dozen other medical organizations and individuals. The suit claimed that the defendants had participated for years in an illegal conspiracy to destroy the chiropractic profession. The AMA had formed a committee on quackery, which on the surface sounded noble. However, secret internal memos surfaced in a book by an informant which revealed that the committee's primary mission was to work covertly behind the scenes to destroy the image of chiropractic.
The architect of this committee was an attorney by the name of Joel Taylor. When Taylor was subpoenaed to go to court, he had a chance to stand up and defend his 11 years of dishonest propaganda against chiropractic. But instead, he fled to Arizona and out of the jurisdiction of the Northern Illinois Federal Court. But we were able to get the court to demand that he take a video deposition in Arizona when he actually admitted under oath that he knew very little about chiropractic and that he didn't even know if his information was honest or fraudulent. And then he didn't care. He said he was just doing his job. To further illustrate the disingenuous attitude of the AMA, they had a clinical outcome study of chiropractic done within a military hospital by a Dr. Urban Henderson during World War II, who was a member of the AMA Board of Trustees. The military hospital studies show that chiropractic was very effective, but the AMA suppressed this information for over 60 years until under our subpoena, the AMA grudgingly released this study. The study also found that pregnant women under chiropractic care had an easier time delivering children, which, by the way, chiropractors are working in military hospitals today.
In August of 1987, after endless wrangling in the courts, U.S. District Court Judge Susan Getzendanner ruled that the AMA and its officials were guilty as charged of attempting to eliminate the chiropractic profession.
It was purely economic. The chairman of this committee, Dr. Joseph Sabatier, would attend medical conventions and tell the MDs that chiropractors were, in his words, stealing their money.
Chiropractic stresses the importance of the structural and neurological aspects of the human body, particularly the spine, in the prevention and treatment of human ailments. Its premise is that good body structure and spinal mechanics play a vital role in helping the body function better and have a greater resistance to physical breakdown and illness.
It's a matter of public education. Chiropractic does not have a billion-dollar-a-month advertising campaign that the medical profession receives from the drug industry, which actually spends more money on promoting drugs than it does on research. And then there's the lingering effect of the 11 years of dishonest propaganda of this AMA committee. It is very important for the public to understand that they are not going to get the most objective or honest recommendations for healthcare from drug companies, since they're committed to making money on the drugs. And even many medical physicians agree that there's altogether too much drugs and surgery being used today. We are forever being programmed that whatever ails us, there's a pill for it, with little or no emphasis on improving our lifestyle. And this must change.
Several studies that have been conducted throughout the world over the past 30 years have proven chiropractic's efficacy.
There are many government studies, such as a New Zealand report, the British Research Council, the Canadian University of Ottawa study, and the United States Department of Health and Human Services all agree that chiropractic is therapeutically superior, cost-effective, and is scientifically and clinically based. The prestigious and world-renowned RAND Corporation, the largest think tank outside of a university, found that chiropractic actually has more clinical studies supporting it than many medical treatments being used today.
Through the years, the evidence has been mounting that chiropractic is a safe, effective, scientifically based, clinically proven approach to healthcare.
Chiropractic is the safest healthcare profession in the world. The best evidence of the safety of a healthcare profession is by what its members pay for malpractice insurance. The incidence of injuries within a profession determines the cost of the malpractice insurance. A chiropractor can buy an entire year of malpractice insurance for about the same price that some MDs pay for just 1 or 2 weeks of coverage. This alone speaks to the outstanding safety of chiropractic. Meanwhile, the medical profession has a serious malpractice problem because of drug reactions and unnecessary surgery. Aspirin, the most popular drug used in medicine today, is 400 times more likely to cause an adverse reaction, such as a stroke, than a spinal adjustment. Or putting it another way, chiropractic adjustments are 400 times safer than taking medicine.
Dr. Wilk's book, entitled Living a Prophecy, A Chiropractor's Incredible Story, details, among other things, how he entered the chiropractic profession.
I wrote the book to help people make more intelligent choices when choosing a physician. In that sense, it is a patient education book. I use the word prophecy as a verb rather than as a noun because when I was a child, a family friend prophesied at least 16 events in my life with 100% accuracy. This is obviously supernatural, and I took and passed a truth detector test and have living family members who can verify the accuracy of my story. I don't know of any living person on earth today who has experienced fulfilling prophecies as I have, which convinced me that this took a higher power, which is God. And I've been given a strong calling to fight for more honest health care, and now also as a lay Christian apologist. The greatest physician of all times is Christ, and he said that my people die from a lack of knowledge, and that a house divided against itself cannot stand. Indeed, our health system is divided, and people are dying because they're grossly ignorant of what represents rational, safe, and effective health care. And so they overutilize drugs and surgery, resulting in 150,000 deaths a year. These tragic situations are well documented in medical journals. If our airlines lost 0.1% of the people that we lost from unnecessary surgery and drugs every year, it would decimate the entire airline industry.
Dr. Wilk is concerned about the future of healthcare and believes that chiropractic can play a significant role in preventing many medical tragedies.
There's a lot of discussion about our healthcare crisis. Well, some of the proposals I hear are like putting a Band-Aid on a hemorrhage where we need a tourniquet. We need closer interprofessional cooperation between all healthcare providers, which include doctors of chiropractic. No one profession has all the answers. The Canadian study found that putting chiropractors in hospitals as gatekeepers to oversee and prevent excessive surgery and medications could save Canada hundreds of millions of dollars a year, let alone unnecessary suffering and deaths. And this study can apply to America just as well. I'm sure that God is on the side of honest health care and eliminating unnecessary suffering and death. But it is more important to know that our healthcare system is on the side of God.
To learn more about Dr. Chester Wilk or to purchase one of his books, visit chester-wilk.com. His book is also available from bookstores like Barnes & Noble, or you can check with your local chiropractor.